Now we have all Galaxy of speakers with experts, and uh, now we will be moving ahead with panel discussion on energy-based devices. I request Dr. Shilpa Durani to moderate the panel.
Coming to revision of all the energy-based devices, we have some questions for all the experts over here. Real life questions.
And audience can also participate if they have any query.
Okay. They have a question.
This is Arpita. She's 50-year-old, post-menopausal with LMP last menstrual period 3 years back, coming with complaint of vaginal dryness and dyspareunia and loss of libido. On examination, she has dry atrophic vagina with cervix is taken up. What EBD can help her if she is also prescribed with vaginal estrogen? Should we give her something else other than vaginal estrogens?
Now we have CO2 laser, we have HIFU, we are having radio frequency. So one by one can give what all we can use, which is the best one.
Carbon dioxide laser, because it is ablative and it regenerates. You get brand new skin. So in that age, CO2 laser is the best for vaginal rejuvenation.
But
All
the vagina
other-
is atrophic and cervix is taken up.
short. Yeah.
The cervix-
So
cervix-
you have to do priming with estrogen. When there is senile vaginitis, when there is petechial hemorrhages, you're not supposed to do that. You have to prime the skin for 15 days and then only you have to work with lasers.
Do you use PRP with this or directly only
yes,
laser?
yes. I do a combination of both.
So
Combination.
understood why
Vaginal.
carbon dioxide laser, as Madhuri has shown very beautiful chart of comparison. So when you're talking about the atrophic vagina, you're talking about the cervix taken up. What do you mean by that? The depth is very much decreased.
I'll tell you that.
If you use something else which is going more deeper, it will cause harm. Carbon dioxide laser 0.4 micron finish. It cannot go to rectum, it cannot go to anywhere, nothing.
So
what
one
is the
thing I want to add is lasers. They ablate, they regenerate new skin. Okay. All the other ones, diode laser, erbium, radio frequency, and HIFU, they don't ablate. Okay. They just expose the tissue to heat. So what happens when the tissue is exposed to heat? The collagen gets denatured and it heals. That's it. You're not ablating. You're denaturing the collagen and destroying its structure. Repair happens. As for CO2 laser, regeneration happens. So with all the energy-based devices, lifting and tightening happens. With CO2 laser, you regenerate. Neovascularization happens. New skin cells.
How many sittings you prefer in this patient?
3 sessions. Monthly once.
6 weeks apart.
How much duration apart?
4 weeks apart.
3
And if you're
sessions, 4
combining
weeks
with
apart.
the PRP, PRP is always after 15 days of after the CO2.
Not in the same sitting?
No.
Okay.
Actually,
and
it
how
raises
much
the temperature, na? Though maybe platelet will get disturbed with heat.
and how much you
effect.
charge the patient?
My patient,
Which CO2 laser is you
it
recommend
doesn't
is
have
the
any
best?
consumables, but the cost is very high. So you always need to have 2 options. One costly version, one cheaper version.
Like,
if she
ma'am-
can't afford, do a PRP. Do a PRP. Only PRP.
Ma'am, this patient like this is now she's 50 and she has come to you and you have done the laser for 3 sittings and PRP everything has been she's satisfied.
Yeah.
Now after again 1 year she comes again. Do we
Yeah.
need to repeat again?
A top-up session, one is enough.
So
usually.
how much
Touch
top-up
up, touch
sessions
up.
are needed? How much
Top-up.
top-up sessions are
As
needed?
long as we live. You can't stop aging.
Not stop.
Okay.
You
Okay,
have
thank
to
you.
stimulate collagen.
Even people who are taking the anti-aging medications and stem cell therapy, they also repeat it. Only then they can stop their anti-aging, na?
Thank you. Thank you so much.
Next question is, we have Miss Kavita. She's 60-year-old and she comes with complaints of urge in urinary incontinence and she has a history of recurrent UTIs. She is sexually active. On examination, she has dry, pale, atrophic vagina. Which EBD can help her other than the most famous drug we are giving nowadays, Mirabegron? Can we help her with something else other than the drugs?
Electromagnetic chair works very well.
Chair for
RF, PRP,
both SUI and urge incontinence, or only for both?
for, for both.
Chair will
Urge,
work for both.
Stress.
PRP,
PRP, we can add PRP.
Ma'am, for urge incontinence, will the chair work? And for
Yes,
stress
yes.
incontinence?
Stress.
Basically, one thing I want to add.
Urge
Urge is
incontinence or
because of
stress
estrogen
incontinence?
deficiency mostly. So even a estrogen cream helps with that. Then CO2 laser and a combination of all these.
Ma'am, for the age 60, she's 60 years. For this patient,
Here,
We will avoid
how much, what is the dose, like how frequently asked to apply the estrogen gel to this patient?
here I would say that since she is sexually active, doing an RF and putting her on estrogen therapy will remodulate the atrophic vagina. Then for the UTI, you can add on other EBDs and other things. Because
So
she's,
gel,
her
how-
importance could be sexually active with UTI.
Is
So
the gel
controlling
safe?
the UTI and stress incontinence will make her sexually active with the RF. No, not necessary. Her life is now restored. Her sexual activity is restored, whereby she is again inclined to take another session. Here, the key point here is she is sexually active. So restore the sexual activity
So we will give her vaginal estrogen.
with treating the UTI.
We'll
First
give
of all,
her
treat the UTI.
chair sessions, MCLR chair sessions, and we'll give her CO2 laser also. We will, and PRP also. RF will be better than CO2 in this case.
These
Dr.
patients
Madhuri wants to
actually,
say-
there is no set, I can say the rules and regulations. You have to see three things. What is her priority? Number one. In these patients, mostly this word urge urinary incontinence is the biggest priority. For recurrent UTI, she is taking. Believe me, the patient was coming with the recurrent UTI. If you'll see, she is labeled as a recurrent UTI. She is not having any infection. She is taking unnecessary antibiotic. And the reason is urge urinary incontinence because of the degenerated urogenital epithelium. The chair is such a wonderful and such a cheap alternative, and nothing. She come and sit. And what does this actually? There's an increased blood flow in the whole pelvic floor. When there's an increased blood flow, it is going to have a good effect. So this patient chair, I don't say ki don't use a EBD. You can combine the EBD, PRP, whatever. But chair along with the estrogen is the cheapest, easiest, and the most acceptable reason.
Ma'am, how long this gel can be used?
Yeah, estrogen.
Yes,
Because it doesn't absorb. You can give up to 1 year very easily.
Daily?
No. You have to taper once a week.
Once a week? Once a week, okay.
So we'll just have a last question as we have very limited time. We have Mrs. Richa, she's 22 years and she comes with complaints of vaginal laxity after full-term normal vaginal delivery with episiotomy. She also has pain on her episiotomy suture area. On speculum examination, she has fibrosed RMLE scar with some tenderness and some amount of vaginal laxity. What EBD can be used for her and how much expectation of result can we give her? How much benefit she'll get? She has just
Here-
delivered 6 months back.
I would say कि a combined chair with erbium YAG, because erbium YAG has a very it has got a very scar treatment के लिए erbium YAG is very good, very effective along with the chair.
Yes, you can do scar revision with PRP. Especially for the scar. Break the adhesions.
And the moment the episiotomy is scarred, that below the fibrosis is, you can break with the needle and pain is gone.
Ma'am, which needle we can use? Simple needle. Just remove the adhesions beneath.
Usually there are suture granulomas which you miss. So you have to be very careful.
Perineal scar revision, basically.
Many people will not go in this field because they don't want to buy a laser. Either they go and buy the 6-7 lakh of the laser, and that is the going to the core problem. So here we want to give something which you can use it, and most of the patient. It's such a simple thing to do the needling and you can break the fibrosis. If you have lasers, RF or anything you can use, but
We don't have lasers, we'll do needling, we'll give her PRP, we'll ask her for Kegels.
PRP, Kegel is out. PRP is a chair. Nobody does. These two things are the wonderful. If you have, you can add any EBD after that. But the chair, you can allow every normal delivery patient should sit on the chair. It is a 20,000 Kegel exercise. It's not only Kegel, it is about the whole pelvic floor.
So the consensus is we should buy the chair and
Yes.
CO2
First
laser.
step is chair
There
for
is the
you.
basic thing. Next, one more. We have Mrs. Vinita. She is 35-year-old and she comes with complaint of stress urinary incontinence. She has 2 normal deliveries which were uneventful. Last childbirth is 10 years back. On examination, she has cystocele and she has 2nd degree uterovesical descent with intrinsic sphincter defect. What EBD can be advised if she is not willing for surgery, BUSH or TVT or TOT? Last question, just 5 minutes. EBD of choice. EBD of choice for this patient.
We have CO2
The
and
laser,
vaginal
the laser that
threads.
you have.
Vaginal thread lifts.
A laser which will
vaginal
penetrate a
thread lips.
little deeper on the anterior wall will help her. Okay, so she has to undergo a surgery. Thank you all for the attendance of the panel.